Dean.
Hello, Lilou.
How are you doing?
I'm very well, thank you. It's really fun to know that I'm talking with you in France, and here I am on the coast in Oregon in the States.
This is so wonderful. I so enjoyed our conversation in person that I'm excited to do this again over Skype. Now I know a little bit more about your work. And
Okay.
I was reminded about your work through an email that you sent to the nurses and social workers that you work with, because I know you're putting together something very important for these people over in October. You're an author. You wrote Doctor's Order, Go Fishing, and
Yes.
also why love heals, and this is what we're going to talk about. But this conversation is really for everybody. It's not just for nurses or doctors or social workers. It's for everybody to understand the impact of our emotions, of our state of mind. This is really what you got. Tell us about the research that you have done and what you have found in your work.
Okay. Briefly, I was director of mind-body medicine for a large group of cancer centers, and I was very interested in the will to live, and could helping develop a will to live with cancer patients affect their survival. Actually, we were more concerned about their quality of life, but in fact, we found in teaching them a 6-week program that I developed, 2 hours an evening for once a week for 6 weeks, that in fact it improved their survival. So that caught me by surprise in a nice way, but also when I went to write up my research was to come to terms with it wasn't the will to live that made the greatest difference, because a big surprise, another one, was that people found it too selfish to really make time and take time to do what they really wanted to do. The idea of the will to live, what gives you a zest or reason to live. And it was because, in fact, that they felt listened to and cared for and supported that made the difference. So that really drove me then to write Why Love Heals, because for many of your listeners, I'm sure it makes perfect sense to them. If you feel loved and cared for, it would affect your health status. But I really wanted to understand this better. And so fortunately, I took that time and had the opportunity to look
Yeah.
into why love really does heal. And now I'm very interested in sharing what I found with others.
Tell us more about the research and how do you measure that? How do you measure love?
Yeah, good question. And it is interesting that when I made my final conclusions in my research, Why Love Heals, the editors of the journal allowed me to offer my clinical opinion, because that's really where my insight came when I was going around to all of these cancer centers and teaching the program, and then asking them what in the program helped them, even what didn't, so that I could revise the program as necessary. And in the end, they told me it was because that I listened, I cared, I was sincere. And it took me a while to understand that it wasn't any specific coping skill I taught them. It was this idea again that they felt loved and cared for. But what helped me is it so conformed with Dean Ornish's research with heart disease, and also a psychologist by the name of James Lynch, whose work preceded Dean's, looking at the role of loneliness in heart disease and how important it was to feel heard and understood. And where these major researchers were making very similar conclusions.
I've heard like a lot of people about Heart Math Institute. I mean, I'm wondering what happens physically.
Uh,
Are we talking of frequency? Are we talking of something emanating from the heart? I mean, how is this transmitted?
Right. Well,
How
the
do we
Institute
measure
of Heart
it?
Math, in fact, has determined largely through heart rate variability, but you can look at numbers of variables, and when you feel more at ease, even just more relaxed, automatically your heart rate is in a more healthy range, your blood pressure, so many variables, your immune system. So when we did my research, we weren't able to measure that, but when Dean Ornish did his, he found, in fact, that it affected blood circulation, very clearly measured with the heart, and he published in the world's best medical journals. And then when James Lynch did his research, he similarly found in looking at blood pressure in particular, hypertension, that it was dramatically affected by when people felt heard and listened to versus when their conversations or contact with others were not heartfelt. They were just more cold or matter of fact.
And you did some research also in epigenetics. Could you tell us about that?
Well, epigenetics is a field of study where they're looking at factors that affect genetic expression. We know that we all have genes, but we're not stuck in the sense that you have these genes, so you can only do this and you can't do that. The genes suggest that we have predispositions for certain tendencies. But what causes a certain predisposition to, in fact, express is based on lifestyle. So how you feel, your good nutrition or poor nutrition, etc., affect which genes actually, we say, get turned on or off. Right, so there's no question in my mind that in my work, although again, we didn't measure specific variables, Lilou, we looked at survival. We just looked at the end result and found that there was a really big difference with stage 1 breast and stage 1 prostate cancer for those who had gone through my group and otherwise were an exact match as best we could for those who had the same type of disease, stage of disease, date of diagnosis, age of diagnosis, etc., that the people who went through my program did significantly better.
Were you able to also see that people during their lifetime that are not lonely, that are connected, that have loved ones and friends, and that really have a sense of being loved and share are less prone to cancer or some diseases than others?
Right.
Is that something that you got interested into?
Yes, I didn't do that in my study. There are so many great questions you're asking that I wish that we had more evidence to support this position. But in fact, there's no question we know that when people are living a healthier lifestyle, that they are healthier, whether or not we understand all of the dynamics why. I mean, you can even get down into looking at telomeres and so forth, related to nerve endings and blood and so many variables. I wish that I had the time or that people would invest the time and money and research dollars to look more closely at this. I think it's only a matter of time before we start to do this, but there's a huge amount of competition for research dollars, and generally speaking, it tends to go with looking at new pharmaceutical approaches or maybe surgical procedures or whatever. But I used to joke if we were going to apply for a grant with the intent on our end to look at when people go fishing, when they do what they really, really love, was that going to get funded for looking at some new drug and so forth? And yeah, right. So unfortunately, we just are not doing, I think, some of the research that really needs to be done that would help explain this better.
But obviously there are some nurses and doctors and social workers that you're working with and that come to your seminar and that they want to learn more about this. So what do you teach them, and do you really see a shift happening also in the industry? I mean, what are the good news?
Yeah, no, there's a very big difference actually. The primary thing I still like to talk about is doing what it is you love, making time and taking time to do what brings you the greatest joy and meaning in your life. But I teach a variety of subjects. Like next month, I'm going to talk about compassion fatigue and how, as healthcare providers, whether professional or personally, you're taking care of someone, why it is that you need to take care of yourself and how you can do that. In November, I'm going to teach about integrating mindfulness and meditation and imagery practices. And when John Kabat-Zinn did his wonderful work at the University of Massachusetts in a stress reduction clinic, he did something that was highly unusual, and not just by teaching meditation, but in medicine we say that everything is based on one's diagnosis, and then your diagnosis determines treatment. So everyone would likely then get a different treatment dependent on their diagnosis. Everybody got the exact same treatment in John Kabat-Zinn's program, meditation. And so across all chronic diseases, pain in particular and so forth, he saw huge improvements. So that's another thing as part of my doctoral rotation, which was relaxation guided imagery and wellness, is simply teaching people to relax is automatically going to help them to be healthier.
I just came back from Scandinavia and interviewed a woman that used to work very intensively with cancer patients, and in the strict medical, industry, and now she brings together the two worlds, because she's not really against the traditional medicine, but she thinks and feels there's something missing, and combining both is really the best way, in particular when a person received a diagnosis, because it can be really a traumatic experience from my understanding, and there's a lot of healing that needs to take place just right there. When you say a disease is incurable, and then how can the body react?
Probably the most stressful thing that you will ever experience is the fear of your annihilation, your death. And so when you are diagnosed with cancer, my experience is that most people don't have as good an understanding of what can be done to treat cancer today. And the fact is that their immune system is stronger than any cancer cell. If you were to really put a white blood cell in a test tube and then a cancer cell, most people think that cancer is this great, big, mean, nasty thing and would automatically gobble up the immune cell, when in fact it's exactly the opposite. A cancer cell has never attacked an immune cell and never will. A healthy immune cell will have that cancer cell for lunch every time. So I think it's important that we educate people about this. And interestingly, there are approaches now called integrative medicine or functional medicine, where they're looking at much more than conventional approaches to healthcare. And so Dr. Andrew Weil at the University of Arizona here in the States, and I co-authored the chapter on mind-body medicine in Dr. Weil's text, Integrative Oncology. Again, looking at lots of ways to approach treatment with cancer. And in that book, I think there are at least 15 or 16 different therapies well documented beyond looking at radiation, chemotherapy, surgery in the treatment of cancer.
What are some of the ones that are really recommended?
I think that today most in the field in functional medicine and integrative medicine tend to think more now in nutrition, really emphasizing the importance of good nutrition, and so also exercise. I obviously have a tremendous bias with the mind-body medicine approach, because I believe very strongly, as did Dean Ornish, when he did his great research looking at nutrition, exercise, and stress management with heart disease, even though most people today still focus on the nutrition part of what he did, he states very clearly it was the stress component that was most important. So I would say, which are the three pillars for wellness anyhow, nutrition, exercise, and stress management. If you can do those relatively well, you're going to be far healthier than someone who doesn't address those areas in their life.
Is when you say mind-body medicine, it means the alignment, the coherence between the mind and the body, having one. How do you define this actually?
Okay, well, interestingly, somebody like a Dr. Candace Pert, who was chief of brain gut biochemistry for the National Institutes of Mental Health here in the States, she makes no differentiation between the body and the mind at all. In fact, if you go to the deepest level in quantum physics, there's a whole concept of oneness and connectedness, where we know it's all one. We just have a way of wanting to separate it and break it down and understanding the tremendous connectedness of everything. But she showed through very good research that any thought or feeling you have immediately registers in the body. But what really is confusing and hard for science to deal with is there's no cause and effect relationship. It's instantaneous. So how can that be? But the fact is, and we certainly know now in a field of study called psychoneuroimmunology, that your emotional state directly affects immune function. So whether you're feeling, as she would say, more genuine and more aligned, as you said, with honoring your true feelings, your immune system actually works better than if you stuff your feelings or suppress them. So it is important that people need to learn to accept and roll with the punches, whatever life throws at them. And what I'm saying is not easy to do. I know what I'm saying sounds simple perhaps, but it isn't easy to do. And that's why I like being in my position now to help all people, whether they're professionals or the general population. How can you manage your life more effectively, bring more joy and meaning to it? And then actually your health is a byproduct of that.
So you need to be aligned with the diagnosis, you need to be aligned and okay with whatever's going on in our life. Is it what you mean by going deeper into who we really are?
Well, I don't want to say that it means that to be okay with it. I mean, if you're diagnosed with cancer and you think you're supposed to, be, thrilled about it, I mean, that doesn't make sense. It's more coming to terms with it. It's okay to be depressed. That sometimes in life, you're just going to get knocked down pretty good. And at some point, you need to accept what is happening. The difference is you don't want to get stuck. And that's why, whether it's a good friend or a professional, you need somebody sometimes to help you just put things back into perspective and, okay, what do we need to do, and make an effort to do what you can to feel better.
So how, I know you obviously then we go back to happiness and joy and love, and is there a technique that you teach to feel this more and more into our lives that we can all apply?
Yeah, well, it's not so much a technique. I call it common sense. You know how the expression goes, when you're busy doing what you like to do, that you tend to forget your aches and pains? I've never said that to someone that they didn't know what I meant. And so I would just, elaborate on that subject, but is part of what I have people do is to think about what are their interests, what are their values, what are their feelings, what are their needs, and to really think about what matters to them and who they are. And in that process, what I found is that what everyone seems to be looking for most of all is peace of mind. So when I understood that, I thought, okay, so when do we have it? How do we get it? And it became quite clear to me that we have it most, we get it most often when we're going fishing, when we're doing what we love. It comes back to this common sense. When you're busy doing what you like to do, you tend to forget your aches and pains. So my prescription is that they have to have fun one time daily. We actually used to write that prescription at our cancer centers. And I know it sounds silly, but that's part of then when we talk about doing research in this field, okay, we're going to test a new chemotherapeutic drug, or we're going to test having fun one time daily. You see, it sounds rather Pollyannish to think about the one, but it's anything but. I think it's imperative.
Yeah. It's so easy and so right there in our face that we try to complicate it and try to. It's just so obvious, isn't it?
Yes.
And to some it has to be more difficult, and there has to be something else.
Yeah. But as a psychologist, but I know you understand this and your audience will too, is that when we're younger, we have lots of experience that erode our self-confidence and erode our self-esteem. And we learn lots of rights and wrongs and shoulds, and this is appropriate and this is inappropriate. And so what I found in looking at this is that there's a generally a perspective that taking care of yourself is selfish, and that's inappropriate, and everyone and everything else should come first. So that's a very big hurdle. And remember I said earlier that my patients then couldn't really do what they really wanted to do because it was too selfish, and then I couldn't conclude it was the will to live that made a difference why they were living longer. And that's why I had to look deeper and really believed that then it was because they felt listened to and cared for and supported.
So you have an event in October. Can you tell us about it, where it is for people that might be listening right now and interested to come?
Okay, well, it's in beautiful Yachats, Oregon. It's right on the coast in Oregon. It's due west of Eugene, Oregon, about a 2-hour drive, and in a beautiful conference center right on the ocean. Couldn't be more beautiful. And we're going to talk about why love heals and really look at what I found to be, I think, a very strong perspective on not only that love heals, but how that actually works. So we're going to do that for 2 full days on a Saturday and a Sunday. I think I'd have to check the exact dates.
It's on the 21st or 19th? Or...
Yeah, it is. It's the 20th and 21st of October. Right.
Beautiful.
Right. Yeah, and then in September, I think it's the second weekend in September. It's very early in Medford, Oregon. I'll be part of a panel with Dr. Len Lasko, a physician, and Sue Kretschmann, a nurse who is an expert in nurse education, and myself will talk about compassion fatigue. And then in November, I will talk about integrating mindfulness, meditation, and imagery. But also, I've gotten back to teaching my 6-week program. And in October here in Yachats, Oregon, on the coast again, I'll teach that 6-week program once a week for 2 hours each time. And that's what I really love. And I want to get back actually working with cancer patients again. I hope next year to be working with a couple of cancer centers and teaching that program directly again to cancer patients and their families.
Well, I think it's a blessing to meet you in person, to have met you in person, and for anybody that has the chance to get infused by your enthusiasm and passion and work. I mean, this is a blessing in itself. So thank you, Dean, for taking the time to do this Skype interview. We made it. We made it happen.
Okay, thank you. Thank you.
Thank you.
Take care. Good to see you.